The world now suffers from diseases like heart disease, diabetes, lung disease. These diseases are called chronic non-communicable diseases, or NCDs. So multiple chronic conditions are when patients have 2 or more of these conditions. Conditions like high blood pressure, depression, substance use, and require multiple types of interventions, multiple drugs, and multiple providers. You can just imagine how complex and difficult the care for these patients are.
One in 3 adults globally has more than 2 conditions. We decided at Teva that this is a staggering problem for global health and that we really need to see how we address it. Teva is the largest generic pharmaceutical company with the most diverse portfolio of medicines. We reach hundreds of millions of patients every day globally. We partnered with Mount Sinai because we wanted an organization that really touches on patients.
One of the first things that we found in our research is we have to engage. One of the biggest barriers that patients raise with us is trust. So how do you scale trust and how do you engage where patients are in the neighborhood and community setting? That's the secret to engagement.
How to build trust, honestly, is taking off the lab coat, and I don't mean literally, but just sitting with the patient and being real with them, letting them know that I'm a patient as well. I'm a member of this community as well, and I understand a lot of things that they're going through.
Some of the challenges that I face in my work as a social worker with patients with multiple chronic conditions is just the education, teaching them about why it's important to care for themselves, what are the risks if they don't care for themselves, who would really lose out if they don't care for themselves, like their loved ones.
In the beginning, it was hard to accept that I was one day fine, and then it seemed overnight that I had a whole lot of different issues going on with me. The healthcare providers help and can help by listening to the needs of me or other patients, trying to understand exactly what I am. Sometimes I myself don't understand exactly what I am feeling. I have learned that I have to pay attention to my body and to what it is telling me.
So moving forward, and we see this as a long-term endeavor, we wish to pilot programs and see how we can really reach impact in terms of changing people's behavior, improving their adherence to medicines, empowering them to be able to self-manage their conditions.
So what we're asking our patients to do was to be accountable for their health, helping them to realize different interventions on our together will help lead to better outcomes.
I feel that I have been lucky and I have been blessed because I have a team of doctors that are very open to me, even with the pain that you're still really deep down inside the person that you always were, and to treat you as such, as a person, and not just see the pain, but see the person as an individual. I think that helps a lot.